First. Hello, guys. My name is Simranjit Singh, and my colleague's name is Jenny Zetsky. And today we will be talking about advancing world health equity, and we will be also evaluating the research paper as well. The presentation follows the nine-step evaluation model that we have learned in the class so far, and we have applied it to this research paper, which is titled Oral Health and Access to Dental Care Among Older Homeless Adults. So while you guys are just kind of reading the summary facts of the article, let me just kind of give you some background information. So in 2000, the Surgeon General identified oral disease as a silent epidemic. Despite the availability of effective prevention and treatment methods, oral health has improved little over the past 2 decades. In the US, nearly a quarter of adults aged 20 to 64 have untreated dental caries, and more than half have lost a permanent tooth. People living in poverty have more caries and untreated tooth decay and tooth loss than the general population. Oral pain and tooth loss have a significant negative impact on quality of life and employment by affecting the ability to eat, speak, and smile. And in this case, people experiencing homelessness have inadequate resources for regular dental hygiene and a higher prevalence for risk for tooth loss, including smoking and substance use. Tooth loss is affected by both access to dental care and risk factors for poor oral health. So another word for tooth loss is called edentalism, which is a risk factor for coronary artery plaque formation, diabetes, and certain cancers. And in this case, we're using a small convenience sample of homeless adults that were found to have a higher prevalence of poor oral health than the general population, with high prevalence of tooth loss and untreated decay. So as we can see here, the purpose of the research paper was to examine the prevalence of tooth loss and oral pain and unmet dental needs within the unhoused population in Oakland, CA. And the key factors, as I mentioned in the background information, were age, alcohol, and substance abuse. So step one of the nine-step module is to identify a priority population. So in this case, the initial phase of the research rigorously defined a priority population to ensure that the study addressed a critical public health gap. So in this case, the health burdens faced by chronically homeless older individuals. The study specifically targeted homeless adults aged 50 years and older residing in Oakland, California, with a targeted focus acknowledging the specific physiological and social vulnerabilities inherent in this cohort. The eligibility criteria based on the built on the sample were meticulously established, requiring that all participants be English speaking, age 50 years or older, and capable of providing informed consent. Critically, the definition of homeless strictly adhered to the comprehensive guidelines which are outlined in the Homeless Emergency Assistance and Rapid Transition to Housing or HERT Act. The selection of age 50 as a lower boundary for older homeless adults was a key methodical decision, reflecting the epidemiological understanding of this demographic, and individuals experiencing chronic homelessness frequently exhibit accelerated aging, meaning that chronic stress, poor nutrition, and long-term behavioral risk factors can lead to premature onset of geriatric syndromes and chronic diseases compared to the general population. So by setting off the cutoff age at 50, the researchers ensure that the study captured those experiencing the most compounded health burdens and thereby maximizing the relevance of findings for the targeted early intervention programs that are designed to mitigate these age-related health decline. So the goal basically in the essence was to address the gap of research being done on the aging population and the homelessness when it came to oral health. So step two is formulating a research question. So in this case, the research question is what is the prevalence of and what factors are associated with oral health measures in this population? And the study aimed to measure the extent of oral health problems and identifying such risk factors like age, smoking, and substance abuse. So the investigators here especially focused on four outcome areas: the prevalence of tooth loss, prevalence of oral pain, status of denture fit, and the identification of both sociodemographic and behavioral factors that link to poor oral health. So basically, the decision to structure the investigation around both descriptive statistics or prevalence, as you might call it, and correlational analysis, which is also known as associated factors, provides a comprehensive evidence base for public health action, and establishing this prevalence, such as the fraction of the population missing half or more of their teeth, provides a necessary quantifiable magnitude to justify the intervention. So, in this research article, the fundamental classification of the research design is observational, and this designation is derived from the methodology employed in which the researchers systematically collected data on existing health outcomes, which is oral health, and pre-existing exposure such as socio-demographics, substance use, smoking history, etc., as they naturally occurred within the population. And the study did not involve the manipulation of any independent variable, and participants were not assigned to intervention or control groups, thereby distinguishing the study from experimental research designs. Step 4 is basically selecting the specific research design. So in this case, the cross-sectional analysis or cross-sectional research design was selected. And this design basically captures a snapshot of the population at one specific moment in time. And the data utilized that was collected during the initial baseline interview phase of a much larger ongoing study. So not only was the data collected, there was also data utilized from a larger ongoing study done by Hope Home. The cross-sectional methodology is highly effective for its primary purposes, especially in this case, because we're establishing the prevalence of conditions within a defined population in an efficient manner. But however, we have to keep in mind that design is inherently limited when attempting to establish temporality, because exposure and the outcome are measured simultaneously. It is statistically impossible to confirm the temporal sequence of events. For instance, while a strong association exists, the cross-sectional data cannot definitively resolve whether long-term alcohol use led to tooth loss or whether severe dental impairment, making eating difficult and painful, contributed to poor coping mechanisms, including increased alcohol intake. The decision to execute this cross-sectional analysis and using the baseline data from the ongoing Hope Home study allows a big significance in the methodological strength, because it ensures that the foundational data collection, including the selection of standardized variables, rigorous measurement protocols, and comprehensive sampling, is robust enough to support future tracking of this specific cohort over time. And I'll now pass it on to my colleague, Jenny.
Thanks so much, Sunitesh. So I'm gonna go step 5, determine variables. The study measured both dependent and independent variables. The dependent variables included oral health indicators like tooth loss, oral pain, and unmet dental care needs. Independent variables included age, sex, race, education, smoking, and substance use behaviors. These variables were chosen because they reflect both biological and behavioral determinants of oral health, aligning with the social ecological framework of health behavior. Moving on to step 6, sampling method. The researchers used a purposive population-based sampling method. They recruited 350 participants from 5 shelters, 5 meal programs, and homeless encampments in Oakland, California. This strategy captured a realistic cross-section of older homeless adults, ensuring that data reflected diverse life circumstances within the community. All participants met HUD's definition of homelessness and were able to provide informed consent. Moving on to step 7, implement and study protocol. The study was implemented ethically and systematically. Trained researchers conducted structured interviews at St. Mary's Center, a community organization serving older adults. Each participant received a $25 gift card as compensation, and all procedures were approved by the University of California, San Francisco Institutional Review Board. This ensured that participants' rights, privacy, and dignity were protected while still collecting meaningful data. Step 8, clean and analyze data. Moving on to data analysis was done using descriptive stats, bivariate tests, and multivariable logistic regression to determine which factors predicted tooth loss. These findings show that older age, alcohol use, cocaine use, and smoking significantly increased the odds of severe tooth loss. Interestingly, methamphetamine use showed a lower association, possibly due to small sample size or self-report bias. This step demonstrated analytical rigor and appropriate statistical interpretation of cross-sectional data. Moving on to step 9, the last step but not least, answer research question and disseminating findings. The study found alarming results according to Freitas 2019 direct quotation. 57% of participants had lost half or more of their teeth. 54% reported oral pain, and 40% had not seen a dentist over 5 years. Once again, risk factors included age, alcohol, cocaine, and tobacco use. The authors concluded that poor oral health and access to care are widespread among older homeless adults, which disseminate findings was published in the Journal of Public Health Dentistry in 2019 and was supported by the National Institutes of Health, NIH. They recommended expanding medical dental benefits and developing mobile dental outreach programs to improve accessibility and equity. Now, moving to our critical analysis, we evaluated the article through Salazar's 9 steps process to assess how well the study aligned with the health promotion research standards. So the methodology strength, our evaluation is that the study was both methodologically strong and socially impactful. The authors clearly showed and follow each of the 9 steps, from identifying the population to disseminating findings, which shows systematic and logical inquiry. As far as applied relevance, they effectively linked their methodology and to real-world public health relevance, addressing any urgent needs to reduce oral health disparity among older homeless adults. There is improvement for opportunity based on Salazar's model. One area of improvement would be to incorporate community-based participation early in the research design, for example, involving participants or local dental outreach programs during study planning. Future research directions, we found that could strengthen casual understanding by using mixed methods, adding qualitative insights, or by conducting longitudinal follow-ups to track changes in oral health over time. This brings us to our professional reflection, where we highlight our own perspective and how might build upon this research. So in our professional reflection, we agree that the study's methodological and ethical standards were particularly strong. The research team used validated tools, maintained participant respect, and applied rigorous statistical analysis. We also agreed that the authors' conclusions highlighted barriers to oral healthcare access. The findings accurately reflect the inequities experienced by older homeless adults. However, the study's main limitation was its reliance on self-reported data, which may underestimate true dental health problems. Direct clinical assessments would yield a more accurate picture. And if we were to improve the study, we would incorporate qualitative interviews to better understand lived experiences and the personal barriers of individuals would face. Additionally, collaborating with community dental services would translate findings into practical, sustainable interventions. Overall, we believe this research underscores a major public health need for integrated dental health and social care systems, a direction consistent with holistic, equity-focused health promotion. So these are our references, and thank you so much for your time.